You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. The universities are consistently altering their plans and opting for online fall semesters. Not only that, college football is now being affected, where they're talking about canceling the football season and moving to, of course, in some cases, football in the fall. That makes sense. You got some players who now have joined together. Those players, they want to create an association. Some of these players say that they want to form that association. Some of them say they want to play, but they want to be safe as well. We heard where the Big Ten was supposedly going to announce they were canceling the fall season. That has not officially been made. So we've heard all kinds of things back and forth. So we're trying to figure out in terms of what is going to happen. What we do know right now is that when it comes to schools, some schools are opening, some are not. Some are going through a hybrid schedule where they're on for 2 days, online for 3 days. It's all over the place. Frankly, folks, we'll know in 2 weeks. Joining us right now is the pediatrician, Dr. Irene Mathieu. Dr. Mathieu, welcome to Roland Martin Unfiltered.
Hi, thanks so much for having me, Roland.
So when you see all of this back and forth, when you see what's going on and people are just absolutely confused, you got parents who are saying, look, what are we supposed to do? You know, I got to work. Kids can't be at home by themselves. This is a huge mess we have.
Mm-hmm. It is. It absolutely is. And I think you perfectly summed up a lot of the anxieties that I'm seeing every day in my clinic. People just aren't sure what to do. And it doesn't help, as you pointed out, that, every school district, it seems, is doing something different or kind of changing their minds from day to day as the data changes. But, what I tell parents is that there's really no one size fits all. And I try to walk them through a conversation of their child's individual risk, not just the risk of COVID, but also the risk of that child staying home from school, as well as the rest of the community. Children live in families. They've got parents. They sometimes have grandparents or other elders at home that we need to think about. And then the schools themselves have teachers and staff members. So, it's really a multifactorial issue here.
All right. And so you look at the school district in Georgia. They announced what was going on. They announced what was happening in Georgia, where they went back to school. A student took some photos. They suspended the student, reinstated the student. Now that same school district, they're going online learning. I mean, I kept telling people, look, once you get some cases, school ain't going to be in session.
Right. Right. I think that's a really good point. So it's kind of just a question of how long do school districts want to play that kind of catch-up game of trying to figure out where the cases are and try to chase those down before they realize that it's really not possible to fully contain it and are forced to shut down.
Well, right, and that's the thing again. And I keep trying to explain to people that the moment you have somebody test positive and somebody else does it, school's not going to be in session. I mean, it's going to happen. You simply, unless you look at schools in the same way you see what's happened with the NBA, unless you create a bubble, unless you create something, it's not going to work. Then I had the superintendent in Georgia. He goes, well, we can't police students wearing masks. Yes, you do. You police everything else.
Right. Right. And these schools have had dress codes certainly since I was in school, much longer than that. So dress codes are certainly enforced. So, I think with younger children, it really is hard because developmentally, it's difficult for a 5-year-old to have a mask that fits them properly and to remember to keep it on the entire day. And so to some extent, this is going to be a sort of moot point for younger children who are just developmentally not able to keep a mask on, to practice social distancing, to not touch their faces. But, for older children, certainly we can enforce it, just like we can enforce every other type of dress code.
And again, I don't understand how hard it is. Kids walking down the hallway, hey, mask on. I don't understand that. That just makes no sense to me. College football. You have these coaches who say they want to play. They're saying, oh, these football players will be safer at the university than we'll be going back to their homes. But here's what you're dealing with. You're dealing with 70-plus players on these major football programs, staff, coaches as well. That's more than 100 people who are going to be in these environments. Again, unless you create a containment system, and like this bubble concept like the professional sports are doing, it's not going to work. If for these coaches, here's the thing. The players might be in a contained environment, but the coaches aren't. The personnel aren't. So this whole idea, oh, they're young, they're okay. It's a Major League ball player who is actually out for the year because he had COVID, got through it, but now has a heart issue tied to COVID.
Right. That's such an important point, Roland, because, there has been this myth throughout the entire pandemic that young people are fine, young people are going to be okay. But, we've seen increasingly as we see these young people who have had COVID and survived, that a really astonishing number of them do have chronic heart conditions later. They have evidence of heart damage in some cases similar to people who have had heart attacks. And so I think we need to be really careful about saying young people are going to be just fine. And these are even people who didn't have to go to the hospital, who may have had mild, moderate cases at home. There are people who have psychiatric, neurological, long-term side effects. I mean, the problem is we just don't know enough about this virus to be able to say confidently that young people or people who have mild infections are going to be fine and it's no big deal.
Dr. Irene Mathieu, we surely appreciate it. Thank you so very much.
Thanks for having me.
All right, then. Michael, what the hell? I mean, you're in a tough case. Obviously, parents are having to work. They're not trying to have kids at home for the next 5 months or even longer. But unless school districts are truly coming up with proper protocols, you're going to have chaos. That district in Georgia, perfect example. I don't know, and let me just go ahead and put it out here, and I got no problem doing it. It's a bunch of white parents who are acting a fool, who are saying, I'm not sending my kid to school with the damn mask on, I got freedom. That's a part of this. Now, I know somebody who's saying, yeah, Roland, there's some black people out there. Yeah, but it's a whole different deal. You don't have a lot of black people out here hollering, my freedom, my freedom, my freedom, when we're dying from this at a higher rate than anybody else. And black kids having a lower rate of infection out of black, white, Hispanic. Hispanic, number one, highest rate of infection, they're number one. Whites, 2. Black, 3. Second highest death rate, black.
Well, like anything else in this world, in America world, frankly, the world, everything's so politicized. And take Georgia, for example. Governor Kemp will pretty much do whatever 45 tells him to do. And if that means opening up the schools, he's going to do it. And until, obviously, except for, obviously, some of the mayors in these cities, county commissioners, that say, wait a minute, I'm not going to do what Governor Kemp tells me to do. Obviously, also in other cities around the country. So depending on where you are, who you support for president, if you support 45 or if you support the vice president, or if you're from an urban area, or if you're from a more of color area, everything depends on where you're from and it's politics. And it's too bad because young people are the ones that are going to be impacted and affected. And then you have 45 running around talking about and telling the world, oh, young people aren't impacted by this disease or by this virus, which isn't true. So you have these parents listening to him. I don't know why we're even spending time listening to him anymore, because he's becoming pretty much irrelevant. But because of that, you have those folks you just described, Roland.
I don't understand how many of these people don't understand what's going on here. I don't. I mean, the reality is this here. Adults obviously are different. Okay? Children are not the same. Elementary school, middle school, high school. They're just simply not. And so it's like a situation. I'm here at work, okay? I'm out here by myself. Y'all are on Skype. Staff in the control room. Social distancing. You got a school with 1,000 kids. Ain't going to be that simple.
You're right. But part of the issue is, too, every single one of those kids, to an administrator, to somebody in the education reform fight, is a dollar sign. Let's just talk about what that is as well. It's less about the freedoms when it comes to rural versus urban. It's more about who's going to get the education fund. There's still money from the CARES Act that's sitting around that people are fighting for when it comes to everything from school choice reform to traditional school districts. We won't even get into the decades-long fight for education funding when it comes to traditional schools, public charter schools, private schools, charters alike. You're taking that and exploding it during a pandemic, and you have this fight for who can get the most funding. Well, if we open up in person, we can then ask for more funding to be infused into this. If we're a private school and we open up, we have a competitive advantage over a public school. A lot of this is politics, and Michael's correct, but a lot of this also is the same political fight that we've been having in regards to education reform for decades, but now the stakes are heightened because people saw some of the failures of the traditional system in the fourth quarter. They're looking for alternatives. The traditional system's trying to hang on to the money that they've had and increase it. And those competitions in regards to traditional school systems are also looking at this as an opportunity to increase their quote-unquote market share. Unfortunately, the kids, as you well know, are caught in the middle of adults fighting all over again.
But the thing here, Avis, is that, to me, this isn't about traditional schools, charters, privates, or whatever. It comes down to health and safety. And it comes down to whether or not you have people who are going to have any level of sense when it comes to establishing protocols. That's what the problem is. Again, to listen to this superintendent go, we can't police them wearing masks. We can't tell them what to do. Then you suspend the kid who took the photos because you got exposed. And now all of a sudden folks test positive, and now you got to quarantine people. I mean, this is the problem. And if you're a teacher, you're an administrator, if you're a janitor, if you work in the kitchen, hell, you might have a newborn at home. You're not trying to catch COVID from a kid.
Absolutely. And it was a recent study that said that over 100,000 children have already tested positive for coronavirus in the past 2 weeks. And so to say that children are somehow immune to this disease is just an absolute outright lie. I think what's happening here is, yes, it's political. It has a lot to do with a president who has for months denied and lied around the specific issue and continues to do so to a different extent, but he still does it. It's someone who has also threatened to not fund schools, to pull certain federal funding away from public schools, even though it just accounts for, a relatively small portion of their funding. It's still very significant, particularly for schools that are already underfunded. That becomes an important factor, yes, when people are thinking about being able to maintain their system. But I would also say on the other side of the coin, when we're talking about college football, that to me is all about the money. Now we're talking about a $4 billion industry. A $4 billion industry in which they are willing to, quite frankly, risk the lives of these young men who aren't getting paid, by the way, but making $4 billion for other people for nothing. It is just for their entertainment. That, to me, is just as unconscionable as having young children go to school every day, not only putting their life in safety and danger, because there have been children who have died from this disease, but also putting in danger the life and safety of all of the staff that work in those schools, as well as their parents and their broader communities when they go home.
Well, look, it makes sense that be done. Again, I'm telling y'all right now, school, we get to September. Kids go back, and kids start testing positive. Parents are going to be yanking their kids out of school, and then we're going to have a truly, truly huge problem on our hand. But at the end of the day, what this really lands at is the feet of the idiot in the Oval Office. All right, folks, back to our Roland Martin Unfiltered video in just one moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. Go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.